Well, perimenopause is a shift in where the sex hormones are produced. And the sex hormones are like the fountain of youth. This is very important. When the sex hormones go downhill, there will always be accelerated aging. Hi, it's Dr. Casoni. Today we're going to talk about perimenopause. Now, perimenopause has nothing to do with menopause. Menopause refers to no more menstrual cycle. And for a lot of women, the menstrual cycle can continue even into the early or mid 50s, whereas perimenopause is going to occur much earlier, typically right around 37, 38 years old. Can occur a little bit earlier than that. Those are the outliers, and can occur a little bit older than that, maybe even past 40, also the outliers. So, what exactly is perimenopause? Well, perimenopause is a shift in where the sex hormones are produced. And the sex hormones are like the fountain of youth. This is very important. When the sex hormones go downhill, there will always be accelerated aging. So, prior to perimenopause, the majority of sex hormones are produced from the ovaries, right? The ovaries are not affected by stress. This is what's so important about this shift. So if it's a young female and she's 25 and she's working really hard and staying up late and partying and really beating her body up, right? She may be affecting her adrenal glands, which manage stress, and it's going to probably push her through those long hours, but it's not going to affect her ovaries. And therefore, her sex hormone production will be unaffected, which means she still has that vitality and that youth about her and her libido and all the things that go along with it. Because remember, the sex hormones are like the fountain of youth. Now, once that perimenopausal shift starts to occur, then stress or stepping on the adrenal glands, which is perfectly normal, but doing it in excess is going to be very costly because now it's going to cost low sex hormone production because the adrenal glands are now doing both. And the adrenal glands produce close to 24 different hormones. And some of those hormones are not just about whether or not the adrenals are burned out. Some people have referred to adrenal fatigue or burnout, but they're also antagonistic switches, meaning that if you're stressed, you're not producing sex hormones. In order to switch to sex hormone production, you got to de-stress, you got to switch gears. So if the person's just super stressed all the time, that's also going to be a cost, even if the adrenals are not burned out or in a state of fatigue. So we always want to look at what's in the way of function for these systems and then how to improve function. We really want to try to avoid taking an outside hormone. I did a video on negative feedback. That's worth watching to explain why you wouldn't want to take an outside hormone to support the hormone system, because really it doesn't support the hormone system at all. It takes the place of the hormone system. So your own hormone system goes downhill. But nonetheless, I did a whole video about that. Watch it if you want to. It's negative feedback in the hormone system. So let's look at the adrenal glands and what these symptoms would look like. Number one, you're going to feel fatigue. The adrenals are regulating energy levels and blood sugar. So that starts to go downhill. Might even be weight gain and cravings come along with this. Then there's going to be hot at night, especially if you're with somebody and you're hotter than they are. This is the beginning of a hot flash, right? So hot at night, and then that's going to worsen and turn into hot flashes. Now there's dryness setting in and burning up as the sex hormone or lubrication system or air conditioning system, if you will, is going downhill, resulting in now vaginal dryness. And that vaginal dryness is now getting a little bit advanced. We know we need to jump in and support that hormone system right away on the adrenal side. If it gets worse, those hot flashes are going to turn into night sweats. The dryness syndrome is going to spread to the eyes, the hair, the skin, and eventually even to the joints. The joints are lubricated and the tendons and ligaments, all that starts to get tight and brittle. And you'll start to get joint pain, but it's different than inflammation. The cause here is that as things are getting tight and brittle, pain signals are showing up from the brain to protect the joints, but they're really just poorly lubricated. I call it sometimes the old man syndrome, that kind of tight, brittle old man. So men go through something similar, a little bit older, and it's called andropause. And I'll make another video about that. But back to our females. Once that occurs, the next stage is going to be the night sweats. And the most advanced symptom I would put in there is going to be painful intercourse. And this is not painful intercourse from vaginal dryness. That, of course, would be uncomfortable. But painful intercourse refers to pain that cannot be fixed with lubrication. It doesn't matter the level of lubrication or personal lubrication used. It still feels like shards of glass in there because the vaginal wall itself is now thinning, and that is sex hormone mediated. This is troubling because if that's not arrested, it can get to where there's permanent damage and intercourse may be impossible going forward. It's the only category of sex hormone improvement patients that I recommend a topical application of a sex hormone cream. We want to avoid taking those outside hormones, like I already said, but at this case, we're just getting right to the area to make sure that we're not losing or degenerating or losing any more ground there. And oftentimes we don't need to do that. If we start treatment right away, it's just something we keep track of. But if we're not getting it better within a reasonable window, then we want to step in and have the prescription for a topical application there from the medical doctor. So getting back to the adrenal glands, we have to look at supporting them, which we do with our plant medicines beautifully, our clinical nutrition, but we also have to look at what's in the way of that normal function, what's affecting them. Now, the good news is they respond very well to our style of treatment, acupuncture, herbs, clinical nutrition. However, the bad news is that they are very sensitive to getting overworked at this time period of a female's life, going into her close to 40 years old. So when you're stressing, even emotionally, not just some stress, but over stressing, almost like you think you can get away with it in your earlier 30s, so you adopt a position in life where you over stress. You think you can play Superwoman, but it starts to cost you too much. You start to get that burned out feeling at this time because your adrenals just are crispy, but now with the extra burden of sex hormone production, it's now going to take you downhill. And so emotional stress, physical stress, blood sugar instability, spikes and drops with cravings and weight gain, all of that is going to force your adrenals to be picking you up all day long to manage your energy levels. Well, that is going to cost you with the sex hormone production. We have women who the key to their hot flashes is we had to balance those blood sugars while we are treating the adrenals. And without that, they just don't get the success. Now, some women have less of a blood sugar stability issue, but each person's different. That's why we have to do an intake and figure out where to start. Also, if we look at stimulants, right? So coffee intake is fine generally if it's kept to a minimum, but if it's increased, or especially if they're sports drinks or the energy drinks, they're way too stimulating and they're stimulating the adrenal glands. And so the cost is going to be sex hormone system decline, intense exercise, the exercise that you could do in your early 30s and 20s, which would have your adrenal glands working very hard to get you through it, are now going to cost you to the point where a few times a week of intensity that's extended is going to bring about hot flashes and you're going to fall apart. So what does that look like? This is like your spin class. It's going to be super intense for 45 minutes to an hour. That's the problem. Short intensity programs, high intensity interval workout training, that kind of stuff, that's 10 minutes or 12 minutes or even 15 minutes, probably not a problem. You're working the adrenals, but then you're giving it a break. And then you're getting the benefit of that adaptation and that stress overload. That's fine. But extended CrossFit, spin class, these intense trainings that are longer are going to be very costly at this time. Early on in your life, you're stepping on the adrenals for an hour-long class, no big deal, because the ovaries are not affected. At this time, I have people all the time they're doing spin class, they think they're getting healthy. It may have some great benefits to their sports performance, maybe even lean out their body, but now they're falling apart and having hot flashes and low sex drive. So hot yoga can do something similar. Now, a lot of hot yoga is not really too hot, and so that might be fine. See how you feel. But if it's very hot and your body is really drenched, which can have some great benefits, but it puts your body into a stress state where some of the hormones produced by your adrenal glands are managing this crisis of water loss, well, that's going to cost you. And it's going to cost you the sex hormone system. Now, done once in a while, probably beneficial. This is really more of a concern for the person who is doing it a few times a week. And even then, the question is, are you getting away with it? If somebody comes into us and they're in that time period where we're trying to repair and balance their sex hormone system, we might have to decrease some of those activities, at least short term, right? Long term, if we have you strong enough, hey, we want you to be able to do stuff. I do Krav Maga, and that was always very intense, and there's a cost to it. The question is whether or not you're getting away with it. And if not, do we need a therapeutic time period, like a resting time period, to get you back on track? Now, if a female starts having those symptoms prior to 36, 37, going 35 or younger, then that could be premature ovarian failure. Of course, we want to support the ovaries for that age patient and the adrenal glands to get them back on track, try to sort out what the causative factors are. But that is the outlier. And it also may be that if a female is sick, she's just overwhelmed, not feeling well, then her sex drive will go downhill, but she won't have the rest of those symptoms like the hot at night or hot flash uh, or dryness syndromes, right? So vaginal dryness is definitely the sex hormone system going downhill. If it's just loss of sex drive in a younger female, even in the 20s, they could be just so deficient, their body's not able to build a child. And we forget to remember that sex for a female is correlated with procreation, right? The body is thinking, I want to build a child. And if it can't, then it will naturally downregulate the libido. So we find with our young females who are sick, who have autoimmune problems, and we really are dealing with the inflammation and all the problems that got them there. They're too young possibly to be a sex hormone case, but they don't have any sex drive. We get them back on track physically, their sex hormone system was not the problem. Their sex drive comes back right away. So that tells us a lot about how that female body, the sex drive will wax and wane according to their overall health. For that reason, sometimes for the female, I consider sex drive to be a very important biomarker for overall health, even past childbearing years. And that's not the case for men. In fact, most of our systems and our intake are not going to show up on labs. These are all signs and symptoms that tell us where we're at within a case, but you got to know your physiology and you got to know causative factors, possibly, for that individual. And you've got to work your way through the case, because very rarely are we just treating the adrenals. We're treating other parts that are in the way of function to get the case fully resolved. But nonetheless, we will see that sex drive, when that comes back fully for a patient of any condition that's a female, that's a great sign of overall vitality. Men are a little bit different. There's not a relationship to childbearing. So you'll find that men, when they are not feeling well, they're overworked, they're run down, and they're tired. And if the spouse approaches them and says, hey, are you in the mood? They'll just jump right up and say yes. So they're able to just contribute code, so to speak, and then go right back to bed. And it makes sense. Biologically, they are not building a kid. So their sex drive doesn't wax and wane as much as a female's in relationship to their overall health. Another clinical pearl for that 35, 36-year-old female who might have no sex drive, but not really the rest of the perimenopausal symptoms. So is this perimenopause or possibly just too stressed? So if somebody is very stressed, that fight or flight switch being too dominant, which is what we call the sympathetic nerve system, is too dominant, then that's going to turn off their sex drive. right? So they're not having a lot of the other symptoms. But one clinical pearl is that if that patient, and this is what I'll ask sometimes, if they have a glass of wine or two, which is going to sedate that nervous system and switch them out of fight or flight back to chill mode, or called parasympathetic nervous system. So now they're chill mode. That's where arousal takes place. So you take this female who has no sex drive, you go, what happens if you have a couple glasses of wine? And they say, oh, I'm in the mood right away. Then we know they're just stressed. For the female who really still has the loss of their overall vitality because of some other sickness, or their sex hormone system is going downhill, which could be perimenopausal, they have a couple glasses of wine and they just feel sleepy. They're relaxed and sleepy. They're still not in the mood, right? Or if the sex drive has become to where it's only a few days out of the month, like the female has to be ovulating to be in the mood, that's still very low sex drive, because that should not be the case. We really want to see a regular pattern of drive. And this has got nothing to do with what the person is doing with it, just a sense of the drive on the map. And of course, the younger the person, the more strong that sex drive should be, and the more out of place it is if it's missing. Well, I hope you enjoyed this discussion of perimenopause and sex hormone system. There's going to be more to come, and I look forward to sharing that with you later on. All right, bye.